I think there was another slide of the rules. Um, so again, continuing with our ground rules, we want to hear from everybody, but there's not always time. It is everyone's job to make sure that we have a good meeting. All of us have a right to speak and ask questions, but none of us have the right to be disruptive or disrespectful. So let's have a great meeting together. Um, I'm now going to pass it on to Kevin Ryan, who is our co-vice president of Sandy's, to give us the updates.
Thank you. There are two rallies coming up next week. The Invest in Us rally to increase funding to create better pay for DSPs and other costs is on Tuesday, March 10th at 10:30 a.m. That is at the New York State Capitol in the War Room, which is the location these rallies have been for several years now. We recommend you arrive at least an hour early to get parking and through security. On Friday, March 13th, the rally in the Valley is happening at 11 a.m. The rally will take place indoors at the Rockland Community College Fieldhouse. The address for your GPS is 145 College Road, Suffolk, New York. These organizers recommend arriving by 9:45 a.m. Arnold, I believe, do you have something to add?
Yeah, I'll put so there are RSVPs for these rallies, so they know who to expect and all of that. So I'm going to put those links in the chat for everybody. So if you haven't, I know we've reviewed these and Shamika sent them out, but if you haven't RSVP'd and you're planning on coming, it would be great if you would RSVP. That's going to help them be better prepared for everybody. Okay.
Yes. And also, Danielle couldn't be here today, and I was asked to step in. Okay. We have very special guests today. OPWDD Commissioner Willow Bear, and she will be joined by Kevin Phalanchis, Deputy Commissioner, blah, 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 Division of Physical Policy and Management, and Lisa Salami, Director of Advocacy at OPWDD. They will be talking to us and taking questions about OPWDD budget and general priorities for this year. Let's give them a warm welcome.
Oh, and Sophia, sorry, we do have permission. It is correct, right? Well, we have permission to record and share if anyone missed it and requests the recording.
Sure.
Okay, great. Thank you.
Yep. Madam Commissioner Bear, take it away.
Well, thank you for that. And just Lisa was unable to join at the last moment. She has a sick child at home, but I do have Greg Roberts on with us as well. And Greg, feel free to jump in as needed as well. So I'm excited to be here with you guys again. I know some of you attended the budget briefing that we did, but it was really sort of quick. So glad to dive in a little bit deeper today. I wanted to start out, as I always do, though, by talking about some of the big wins from last year, because I just think it's really important when we have the opportunity to remember all of the good work that happened already as part of last year's work and budget and how that feeds into this year. So in 2025, we did a lot of really great work as an agency and as a system and in feedback with you all and with Sandy's and our peer specialists. So one of the areas that I'm particularly proud of in the work that we did last year was in the area of advocacy, which is an area you guys know really well. So we launched our Office of Advocacy internally at OPWDD with a director of advocacy and a team of peer specialists. I know you guys know and have worked with at least BJ and Chester and Maryland before, right? But we've got a couple of other peer specialists, and that team worked really hard this year in doing a number of presentations and trainings. They do the training for state operations when we hire new DSPs. That team reviews our policies and our messaging and talks to me and my leadership team about what's the most important priorities for you all. And so that has been a really great transformation for the agency this year. We also engaged in a series of listening sessions and something we've been calling Commissioner Conversations, which is me essentially going out and meeting with very small groups of families and self-advocates in their own communities so that I can hear directly from as many people as possible about how our service system is experienced by all different communities. I noticed that we talk to the same families over and over and see a lot of the same self-advocates over and over, right? Because you guys are very good at what you do. But making a point to reach as many different diverse opinions and experiences as possible has been really enlightening for us this year. We also had a full year of the Independent Ombudsman Office. So I know some of you have worked with the IDDO as well. They received something like 1,700 calls over the last year. And those are self-advocates and families that are experiencing complications in the system. And the Ombudsman was able to help them resolve those issues. So we've had a great partnership there also. Our peer specialist team in particular, we're really busy creating content. So it's the Accessing Life podcast and the Know Your Rights booklet and things like that, that the peer specialists have identified as priorities for the self-advocacy community and released and created their own content throughout the year. So I've been really excited to see that. The other two areas where I feel like we've had a lot of big wins this year that I just want to remind people about are in state operations, really turning the tide, so to speak, in terms of making state operations our safety net provider in New York State. So our state operated clinics, for example, have expanded their capacity to serve more people wherever we have the space and the staff to do that. So that's more dental care that's available, more therapies that are available, more psychiatric nursing available. Those types of services that are really hard to come by. We've been able to expand in certain areas of the state, and we'll continue to do that this year. We also in state operations have started operating comprehensive adult transitional homes. And you may have heard me talk about that before, but that's like a short-term model for typically young people aging out of a residential school who need a little bit of time to have some really intensive staffing in a group home model before they can transition to a more community-based setting. And so state operations developed that model, and we have 9 of those operating now throughout the state. And that's been really successful to bring some people that live in residential schools and have a lot of complex behavioral needs to move out of those campus-based settings, those institutional settings, and really work to transition them into the community. So that's been really great. And then the third area to highlight is on our provider and workforce side. So last year, we were able to invest $850 million in our provider community, mostly in certified residential and site-based day programs. So that was money to bring those providers really up to the cost of inflation so that they could pay DSPs significantly more money to do the work that we know we need them to do. So that was a huge investment we made, and it has been really successful. Obviously, DSPs, right? We should continue to pay them more and more and professionalize that career more. I know a lot of you are doing that type of advocacy. Kevin, you talked about the rallies that are scheduled. So that work continues, but we were proud to make those investments. And our providers are telling us how successful that has been in terms of being able to hire more DSPs and get them to stay longer. And so that's been a big win for everybody. All right, so I wanted to highlight those. So this year for the budget, we had sort of those big investments last year. We were nervous this year that there would be a lot less money to go around. We've talked as a group about the federal Medicaid cuts and how that was going to impact New York State. So we were a little bit nervous going into this budget season, but what we saw in the governor's executive budget was fantastic. It kept all of those investments, including the $850 million investment that we were able to make. It kept all of that money in place, and then it increased our budget as well. So overall, it was a pretty exciting budget for us. It gave us 318 million more dollars than last year. So that was an overall growth for us. And Kevin can tell me which numbers I get wrong. I studied all these numbers when I did my budget hearing, and I haven't restudied them in a month. So I might get some of my numbers wrong. But overall, the budget kept in place what we had, and it grew. We have $120 million in there for what we call new services. So on top of what we've already budgeted for, because we already deliver it, we get an amount of money every year to spend on people coming into the system for the first time, people who were in the system, but their needs changed, right? And those sort of new growth in developing new programs. So all of that was included in the budget the way it always is. So that was really exciting to see. Last year, we also had a $75 million investment that the governor made to modernize our campus in Staten Island. So that's the Institute of Basic Research and the clinic there, as well as some talk about a Willowbrook Learning Center that we're building, and all of that funding was continued again in this budget instead of being cut, right? So we keep doing all of that work, so that's exciting. Also last year, we got $25 million to invest in clinics. So our OPWDD clinics, or Department of Health clinics, that provide Medicaid services to people with developmental disabilities. We were given $25 million to give out in grants to those clinics so that they could expand capacity to deliver healthcare services. And we are really close to being able to award that money within the next few weeks. So we had a lot of clinics reach out to us to say, we would like some money, and here's what we're going to do with it. We are going to build a new dental clinic, or we're going to build a sensory room for people with sensory needs, or we're buying accessible equipment to better serve people who use wheelchairs, for example. So we are spending that $25 million this year, and we'll announce soon sort of the clinics that participated or will be participating in that. So excited to spend that money, and that was in this year's budget again as well. I know that you all are doing advocacy around the targeted inflationary increase, or the COLA. That's been a focus of much of the advocacy. The governor did put in a 1.7% cost of living increase this year. So again, that's all of the investment from last year, and then we would grow it by another 1.7% so that we could again raise wages for DSPs. So we were excited about that investment. And what else was in this year's budget? Family care. We put in the budget this year an increase for the rates for family care providers. So last year we increased all of the rates for certified residential services that were run through a nonprofit, all the IRAs, ICFs, but we did not increase the rate for family care providers. So that's in this year's budget. So there is a pot of money proposed in this year's budget so we can make those rates higher for family care providers. There are also, although not our proposals, but really important, the governor put a lot of investments in her proposed budget to expand access to childcare. And this is really important, particularly for our workforce who are getting, right, we've got younger people coming in as DSPs, a lot of them are parents, and paying for childcare is really expensive and hard to do in New York State. So there are a lot of affordability proposals in the budget to make things like childcare less expensive for people, making the cost of automobile insurance less expensive for people, and making healthcare easier to access. So there's a lot of just really great stuff in the budget. I don't know how much detail you want about any of that, but you can certainly ask questions about the topics that are of interest. And what else was in there that was exciting, Greg or Kevin?
I think you covered it, Commissioner, and your memory is spot on. All your numbers were 100% accurate, so nicely done.
Excellent. Great. So I didn't talk for very long because I know you guys usually have really good questions. So we can maybe stop there, Kevin, if that makes sense, and see what you guys want to talk more about.
Thank you so much, Commissioner. Thank you so much. Would you like to call on people for questions, or would you like me to call on people for questions?
Yeah, it's your meeting. Why don't you facilitate?
Sure. All right. First up is Heather has a question.
Hi, my name is Heather Romanek, and I'm on the Sandy's board as the representative from the North Country. I'm also on the Sandy's board of directors with Kevin Ryan. I'm the secretary, and I just wanted to say wonderful presentation, and I don't know if I'm going to be going to the rally on the 10th because I don't know if my group is going down, but I'm going to try and see if I can. But anyways, I just wanted to say great presentation, and I promise to keep up all my advocacy work. And we may have met before at some conferences or the statewide conference or something.
Probably, but it's nice to see you again, and thank you for doing all of the work that you guys do. It's so important.
And also, I wanted to say, like I said this in the comments that I am against institutions. I believe they are segregation and they don't work.
Great comment. Absolutely.
We have two other hands up. First, let's go with Mario.
Hi, my name is Mario. I go to Lexington ARC. I'm a representative of Sandy's. And my question is, we need some people need to work. A lot of them is leaving. We need to keep them to work, and I can't be at the rally. I got other things to do. Thank you.
Yeah, the rallies are well attended, and I'm sorry that you'll miss them. I won't be at them either. But when you say people need to work, Mario, are you talking about how we get more people into direct care, or are you talking about jobs for
different
people
jobs
with disabilities?
For disability.
Yeah. So yeah, it's so important. So in New York State, we are really focused on making sure that we increase those rates of employment for people with disabilities, and this governor is doing a lot of work towards making New York what we call an employment first state, meaning if you want a job, you should be able to have a job, right? And I know that there are a lot of obstacles to that now. And we're very slowly working through some of those barriers in terms of things like how it affects your benefits, right?
Yeah.
And working with businesses to understand how great it can be to hire someone with a disability and what incredible workforce there is out there. Yeah.
Like right now we got 3 short of staff. One of them retired Monday. The program director retired Monday.
Okay.
We're trying to get two other programs to take over.
Gotcha. Yeah, we're doing a lot of work on that side too, Ray, trying to pay people more money. We're offering college credits for DSPs. credentialing, right? Trying to really elevate the workforce. And I think overall it's helping, but it never feels like it's enough, does it?
Yeah. Good luck on your job.
Thank you.
You're doing a good job.
Thank you.
You're welcome.
That means a lot.
Thanks.
All right. Next up is Kevin Ryan.
Thank you. Madam Commissioner, I just want to say it's an honor to be serving with you on the task force, and I know we'll make a great team. What I would like to know is there any progress on the 2.7 increase request?
So again, the governor put in 1.7%. So what happens now, I think you guys know, right, is the legislature will put out their version of what they think the budget should look like. So we'll see if they have money to put forward to try to increase that 1.7% and figure out where that additional money would come from, right? If we're going to spend it somewhere, it has to come from somewhere else. So what are we going to take money away from in order to increase that? I'm excited about the 1.7. Anything it grows from there is even better. But we've invested $4 billion in the last 4 years on the workforce. So we have made a lot of progress in the last 4 years. So anything above that is just extra icing, right?
All right. Sophia has a question.
Yeah, thanks, Eli. Thanks, Commissioner. Thank you for being here today. We really appreciate it. Yeah, this isn't really related to the budget, but I just wondered if you could speak at all to, transportation comes up a lot in our groups, especially rural transportation. But transportation in general. So just wondering if you can speak to that at all. And I'm also curious about self-directed services and if an OPWDD is looking at innovations around how to make self-directed services more successful for people and sort of making that program a little more robust, or just looking at issues within self-directed services. There's quite a number. So I won't bring them up, but I'm just curious on your thoughts. Transportation and self-directed services. Yeah.
So yeah, transportation comes up a lot, and it is something that is almost entirely sort of out of my control and wheelhouse, which makes it a really hard question for me to answer. We obviously have a couple of services where transportation is built in, but when people complain about transportation, that's not what they're asking about, right? It's like, how do I get to a job? How do I get to a medical appointment? Where is paratransit in my community? And those are things that I get flagged all the time as obstacles that we share back out when I meet with like the conference local mental hygiene directors and county service directors, right? And have shared with my sister agencies in the Department of Transportation, et cetera, as significant obstacles. I just don't have any great answer. I mean, the governor in this year's budget also talked a lot about wanting accessible transportation to be a priority. There's a lot of work, especially in the city, to make the MTA accessible and a lot of projects going on down there. So I think we slowly chip away at it for sure, but I just don't have a better answer because it's not sort of my specialty. But I always share it with others as like as a area of sort of a pain point. Self-direction obviously is ours. So it's interesting to have self-direction framed as something that's not particularly robust, I think is the word you used, because New York State gets asked by every other state, how do we have such a robust self-direction program, right? Like we've grown that program to 35,000 people from what was a very small pilot, and spend a lot more money each, like year over year, on self-direction. So people are accessing it, people like it, people are spending those PRAs. We did engage an external consultant to do a review of the self-direction program, and they talked to like 9,000 families, I think, about their experiences with self-direction, and we issued that report a few months ago. And there were a lot of recommendations in there about how to make it less complex, how to make sure it was equally accessible to people, right? I think one of my concerns, to be totally frank, about our self-directed pilot is it works very well for people who have resources and can be reimbursed, but not necessarily for someone who doesn't have that natural resource or support. So we're doing a lot of work on self-direction to make it easier to access, equitable to access, and just sustainable in the long term. I think we see a lot of children using self-direction. That wasn't something that we imagined would be such a high cost or utilized service. So there's a ton of work in the self-direction world. And then certainly if there are specific areas that you think need some attention, I'm happy to hear that here or in another venue too, if you want to just email me offline.
Sure, sure. I think that there's definitely a lot of thoughts from, people across the state, and I think we're looking forward to kind of gathering those together. And when I say more robust, it's more along the lines of managing and your own staff, hiring and managing your own staff. I think it's true, not only people having, all kinds of resource, that making it accessible for people who, right now it's so onerous. And the support, it feels like from FIs, it's very confusing. And it's very spotty. Some are great and some, they're very punitive. And we're losing really good staff, like amazing staff, because of um, it's just some of the way that it's operating, and also just backup. There's not a lot of backup, and looking at innovations. I know in Buffalo there are people looking at some innovations in terms of creating community around self-direction and self-directed supports, and communities of practice amongst keep staff and also self-advocates who are managing their own services. So those are just those are some of the things.
No, that's great. That's really helpful. And I see that Arnold put in the chat the plain language version of the assessment that we issued if people are interested in taking a look at that.
Thank you. Thanks very much.
All right. Next up, we have Shamika.
I actually don't have a question for Commissioner because I actually just saw her yesterday, but I just wanted to comment on Sophia's question about transportation, because the CDD is actually just released a RFP for to address some issues with rural transportation. So maybe I can have them in a future meeting to talk about some of the grants and stuff that they're doing to address transportation. So I just wanted to say that. And good to see you again, Commissioner.
Always good to see you, Shamika. Thanks for plugging the CDD. I had forgotten about that initiative. That's a great point.
All right. Next up, Joy. Joy has a question.
Hi, my name is Joy Gianni. I have a 3-question. Any update from current Trump administration for budget for disability? Any update for housing issue for disability who living alone? One parent says trying to reach you. She's very angry and posting any Facebook group for disability. She named Heather. And last question, what about transportation in Suffolk County? Some people is not happy bus redesign for Suffolk County.
So in terms of, those are great questions, Joy. So the Trump administration, I feel like every day there's news that isn't news, news that changes, right? So we just continue to monitor the best we can. There was a lot of fear around Medicaid cuts from the Trump administration and how it would impact this service system. So far, we have avoided that. Those cuts really were made in the health and hospital areas. And in New York State, we were able to really come up with the money to make up the difference, at least for the time being. At some point, we will not be able to afford to continue to make up the lack of funding from the federal administration, but so far we've done a pretty good job of that. So we just continue to monitor it, and we'll absolutely keep everyone informed when it reaches a point where it will impact New Yorkers, but this governor is determined not to let it. So we just continue to keep our eye on that one. The third thing was about Suffolk County transportation, which I think you were just sharing out for this group. I don't really have anything to add to that. And the second question I didn't jot down fast enough. Does someone remember? Or Joy, maybe you can repeat it.
Hi, my name is Joy Gianni. Have a three-question. Any update from current Trump administration for budget for disability? Any update for housing issue for disability who living alone? One parent says trying to reach you. She is very angry and posting any Facebook group for disability. She named Heather. And last question, what about transportation in Suffolk County? Some people is not happy bus redesign for Suffolk County.
Gotcha. Yeah. So Suffolk County redesign. I feel like there's always people not happy with something, but I think they're committed there to make sure transportation is more available. So for people living alone, which was the second question, I mean, we've got the housing subsidy program that we are also working on. I think I've talked to you guys about that before, trying to make it as flexible and accessible as possible. When we designed the rules for housing subsidy, I think we inadvertently created some barriers and some disincentives. So we're looking at making that more accessible for people who want to live on their own. I'm not sure which parent you're talking about that's all over social media, but that could describe any number of people. I try to respond to literally every parent or self-advocate that reaches out to me. But I don't necessarily see everyone's ranting on social media, but I'm happy to talk to whoever wants to send me an email directly. I hope I covered them all, Joy. All right, awesome.
All right, thank you, Joy. Next up, we have Joseph, who has a question.
Commissioner, thank you so much for the presentation again. So I kind of like what Sophia said about self-direction. So I have self-direction and I don't have a staff right now and I'm kind of struggling. What would you suggest?
Gosh, I'm going to tell you a secret. So my sister-in-law actually lives in a certified IRA and does not use self-direction because that's how complicated it is. So I'm the commissioner of this agency and I can't navigate self-direction because it is that hard, right? It just wasn't built for, I think, everybody in every part of the state, but I'm excited that so many people have been able to enroll in that model and make it work. But I have heard that especially in some parts of the state, it's really hard to identify and keep staff. What part of the state are you in, Joseph?
So I'm like Rochester area.
Okay.
But it's just kind of hard because I just don't have the support and I wish I kind of had the support. You know.
Were you doing that on your own or through like agency hired?
Agency hired. I was actually going through the arc of Allegheny, Steuben. But I've had so many staff and now I don't really know like exactly what to do.
Yeah, I mean, how to handle and help you with that very specific thing is just not something I'm going to be able to jump in on, but I absolutely can connect you with someone in our regional office or in our peer support team that might have some good feedback if you'd like me to do that separately.
Could you,
maybe they have some ideas that are going to be more helpful.
Yeah, could you please? And also, with the transportation, I'm trying, like, there's so many things, like, because I had this transportation that just left, and like, I don't have I just got a transportation company that is reliable, but they're always not like picking me up on time, and they're making me like wait. So, what do you kind of suggest to that?
Yeah, no, that sounds really frustrating. And we heard earlier, right? That's universally true across across the state. Do you guys in Rochester are using like Medicaid transport, or do you
I am.
have like
No,
accessible share
we have
ride sharing
we have Medicaid. I have Medicaid.
transport? Yeah.
But it's just, I wish
It's
that
like
would
any
just,
other public transportation, right? You can't make it arrive on time
no,
and yeah,
no.
that's hard. And those are things that your local elected officials, when you guys are out doing advocacy locally, is something that I think is really important to raise to local elected officials because they have and Greg, jump in if you disagree, but I think they sort of have the most control over those local pockets of transportation. And that's something that it's really important for them to hear from you guys on.
Yeah,
But
Commissioner, typically county run and county funded and planned at the county level. There are some larger counties where the metropolitan area is larger, more, multiple counties, but largely go to your local representatives for those.
Okay. Thank you,
yeah.
Greg.
And if someone can get me, if you want to get me your email address or Arnold can get me, I'll connect you with someone on the self-direction stuff.
Absolutely. Thank you
Joe, are
again.
you able? I don't know if any of us have it, but Joe, are you able to send? Because in our chat feature, you can send a direct message to participants now, and you could select Willow and send it directly to her, or you could send it to me and I can forward it to her. And if
Arnold, I'll
not,
just kind of forward it to you, and then you
okay.
could kind of pass that along if you would.
Yep. So that works. Yeah. So you can go in the chat now and just select my name under a direct message and you can
Okay.
send it to me. But
All
please
right.
don't send it to everyone. We don't want everyone to have
I was gonna say.
don't send it at all.
All right.
All right. Thank you.
Go, 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 go.
What, buddy?
Do you get RTS? Lift line or RTS access?
Out that way. RTS isn't out that way, I can tell you that.
Okay. So no, Russ.
No.
Okay, no.
All right. Alan,
Thank you.
You're welcome because I know roughly where he lives because it's too far out.
Thank you.
All right.
I did not know really well. Thank you.
You're welcome.
Yeah, I did my God.
I did have a comment picking back on what Sophia was talking about with self-directed. I just wish, and I know this from experience myself, when I did start self-directed and knowing people that have self-directed, that there was a way that there was people with even FIs that could help with trainings on how to manage your staff. And that
Yeah.
because only people that really know how to do it, don't get me wrong, I know how to manage and hire staff, but having self advocates do the trainings because that's the best way to do it.
Yeah, I think that's a great idea, Alan, and fiscal intermediaries, right, are supposed to be able to help with this. It's part of the model. It's part of their job. I forget whose comment it was earlier that that's not always fiscal intermediaries vary, right, in terms of their expertise and level of engagement and knowledge. And so I think for some people, they have very strong FIs who help them be very successful, and others have maybe less support from their FIs. So I think for us as the state, it's important for us to really think about the quality of fiscal intermediaries and making sure that that's consistent everywhere and everybody has that same level of expertise so that people can experience the same success in self-direction. But I love the idea of including self-advocates in training. We do it here at OPWDD with our new employee hires, and I know a lot of other provider agencies do it. So certainly within self-direction, it seems like even more important, right, to be part of that training.
Yeah.
all right. Thank you so much, Alan. Does anyone else have any other questions?
I made Kevin, my budget guy, sit on this meeting and nobody wants to ask him a money question.
You answered them all, Commissioner, right up front in your briefing.
Looks like
Easiest
Russell
meeting
raised his
Kevin's
hand.
ever been to, I bet.
When you're talking about Commissioner, when you're talking about FIs, can you like go a little like abbreviate more a little bit? Because I have an FI, but like what's like kind of like they're like in charge of your self-direction budget, or no, not necessarily.
Yeah, I mean, they work with you and your support broker, right, to spend that budget within the right limit. So we give the FI the job of making sure that all of the budget expenses are following the rules that we've created with the federal government. And that's a really important job, right? Because if we are spending money on services in a way that the federal government doesn't want us to, then they can take back all that Medicaid money. So the fiscal intermediaries are there to do that review item by item to make sure that all those rules are being followed. But so in collaboration with you, whoever else is your circle of support, and then your support broker, right, that team should be able to help facilitate how to hire people, how to train them, how to keep them, what we spend money on, and how to bill. So it's
Thank
certainly
you.
a group effort. Oh, a whole bunch of hands went up all of a sudden.
Yeah.
Could I just make a philosophical point back to Joe, something you said? I think it's important to recognize that FIs, they understand policy and they understand the regulations, they understand how to do things legally, but they're there to help you be in charge of your budget within those constraints. So they're not in charge of your budget. They're there to assist you with their expertise so you can be in charge of your budget and do that all the right way and the legal way and the way that's best for you.
Yeah, because like they never because I asked about it and nobody kind of explained it. That's kind of why I brought it up.
Yeah, they're great questions. And I did send Willow your email address. So I
Okay.
sent that as an email to you,
All
Willow.
right. Thank you.
All right, great.
All right.
Sorry, Eli.
No, it's okay. It's okay. John has a question.
Yes, I got a question, especially for the budgeting part of the self-direction stuff. How come, okay, you can move money other places, but there's some money that you cannot touch? Because I think it's state orientated or something like, why is that? Why can't you touch that money? And that money has never been moved or never been touched or anything like that. So why can't you juggle some of that money or try to use some of that money that has been touched or anything like that?
Yeah, I'm not sure exactly which line you're talking about, but when we get the federal government to allow us to run a self-direction program, there's a lot of rules about how to do that. And each of the categories for how you spend money on different services has a limit to how much the federal government will let us spend or let you spend on each type of service. And so we have to have caps. That's like the maximum amount of money that you can spend. So some monies you're able to move, but there's a limit to that. So that's the kind of thing that your fiscal intermediary should be able to help you understand.
All right. Next up we have Robert, who has a question.
Hi, Commissioner. This actually isn't Robert. This is Tina Fitzgerald.
Oh, hi, Tina. I'm sorry.
That's okay, Eli. What I was wondering about is PRAs being adjusted for inflation. I noticed that prices are going up, rents, everything, my mortgage, but yet the PRAs are not making monetary adjustments. Is that going to happen anytime soon?
Hey, Kevin, maybe this is a great time for you to chime in. So we see the cost of living increase to those services, but I think you're talking about like the maximum amount that you're allowed to spend on each category hasn't increased.
Yes.
And that's because that is specifically outlined in our waiver. So we have to file what's called a waiver amendment with the federal government to get them to increase those levels. And that's just we only do that every couple of years, and it's a very slow process.
Everything is slow at the federal level. I mean, the only PRA increases I've seen is actually because my condition is because aging and all my condition, I can do less, so things are going up, but the price of things is terrible.
Yeah.
And Commissioner, just to that point, we do include the COLA does adjust the aggregate PRA level, right? To your point, it doesn't adjust some of the service limits like the IDGS limit, but overall the PRA should be adjusted for inflation. It's I believe it's part of the COLA statute.
Okay, and the IDGA, you have to file a request for waiver or request for change to waiver?
We the state do, not
Yeah,
each
you the
individual
state.
person.
Yeah, you the state, because it's the things that go down there too that are the things like my plow guy almost doubled this year, and then he realized how I pay for it, so he gave me the senior discount so that I could continue to be plowed, even though I'm only 62. He says I usually don't give this to people unless they're 65, but he says you've been a good customer, so.
Well, way to work that, Tina. But yes, those specific limits are in our contract with the federal government, so we can't just change them easily.
Okay, are we working on that now, or is that something that's upcoming in a couple of years?
Yeah, I would say we're not looking to change those for a few years. We're trying to avoid working too much at the moment by opening the waiver with the federal government, but we're working on designing some changes in self-direction overall to submit within the next few years.
Yeah. Sounds good.
Hey, Tina,
Thanks.
I just want to piggyback because you're asking great questions. I don't know if everybody is necessarily following them. So I just want to also make sure that I'm following or got it right in case anybody asks. So Kevin, what you're saying is personal resource account. So when we have one of these increases, whether we call it a COLA or a targeted inflationary increase, if that's 1.7 or 2.7, are you saying then they will see that exact percentage increase within their PRA?
Yeah, the aggregate PRA will increase. Yep.
Okay. All right. Thank you.
And remember, Arnold, part of it is, I know that folks, decide how to spend the money, but where they're self-hiring, right? Some of the expectation would be is that that's making it along to the DSP wages, where they're self-hiring, which is something I think we've neglected to clarify years ago when we did those targeted adjustments, the whatever they were, the 3.25%, the 2%, the DSPs. But that's what we would be doing that. And I think we've gotten to a pretty good process of updating the template, right after the budget's enacted to get that out there to the FIs, and then folks can, submit budget amendments to, show how they're using those additional funds.
Great. Thanks, Kevin.
Hanif has his hand up.
Miss Willow, this is Hanif Joseph, a South African and a AmeriCorps alumni. I have a couple of questions that concerns and thought. Does the agency is involving voting rights or law enforcement or redevelopment? Well, something's not right.
Oh, sorry, I was on mute. Your audio broke up for me a little bit. I don't know if it did for everyone.
I have these headsets, so let me show we're connecting. I was saying, I'm Hanif Joseph, and I am a self-advocate from the AmeriCorps program as an alumni. I have a couple of questions that brought to my concern. Does your agency involve? Does your agency handles with voting rights and law enforcement enhancement in development or redevelopment redevelopment of handling persons with disabilities?
So the first question was about voting rights, and
Yes, there's been some change. There's been some changes in the State of the Union adversary. The person with disability might get a free pass when it comes to new vote. When it comes to new voting legislations, and its incentives attached. I'm not, yeah, it's on the tip of my tongue, but it's a long presentation, so. Do you, if possible, you clarify the changes that you might anticipate for this new the next 100 days proposal?
Hey, Hanif, can I jump in and you tell me though if I'm right, because I think I might follow at least one piece of what you're saying about these changes. So the proposed requirements of identification. I know a lot of people getting formalized services don't always have an official New York State ID, and that there's concerns that that requirement could become a barrier. Is that sort of what you're referencing?
That's the second. No, but it's the second one. We've been having these frequent discussions about in broadening IDs with a picture, because we had an event where two homicide victims that they were killed with ice, and now, and in between those tragic circumstances where ICE agents has mistreated a person with a disability, and happens to be at my realm, for raw footage.
Yeah, no, thanks, Arnold, for clarifying. I thought that was what was being asked. I know that there was the federal government, right, talking about requiring photo IDs for voting. Fortunately, states control voting rules for the most part, and that is not a requirement in New York State. And I think this is the only state I would want to live in right now. I think we've done a very good job of being proactive and protective, where this federal administration has talked about cutting funds and services and rights for people. So I wouldn't worry too much about that in New York State. But Greg, I don't know if you have anything else that you want to add there in terms of our work in like motor voter world.
No, that's right, Commissioner. Much of the voting rules are down to the state level, although there's a lot of talk that the current administration in Washington might try and change that. But New York is a leader in fighting to maintain rights, voting rights for people, and we anticipate that will always be the case here. It's certainly at least under this governor. And Saini's does a lot of work on educating people about voter rights and making sure that people know how to vote. So. You're really with the right group of people, Joseph, to make sure that your rights are respected and that you do have a choice of who you want to vote for.
Well put, sir. Thank you.
All right. Joy, you have another question for the commissioner?
How much budget for Suffolk County now to 2029? Second question, affect budget and with war with Iran.
I think the question was about the war in Iran and its impact on budget. Did I understand that, Joy?
How much budget for Suffolk County now to 2029? Second question, affect budget and with war with Iran.
Yeah, it sounds like the second question is what you thought, Willow. Yeah,
Okay.
yeah.
Yeah. I mean, the war with Iran is so new and fresh, right? I've got absolutely nothing to say or add, other than I know that New York has been proactively trying to get guidance out to people who might find themselves in impacted countries in the Middle East and having trouble returning to New York State. So certainly let me know if that's an issue. Other than that, I really don't have any insight there, and I hope it's very short-lived. And I don't know the Suffolk County budget specifically. I think that's something county driven. It sounded like transportation budget in Suffolk County, and that would be up to I don't know if Suffolk County has a executive county director or sort of what the local government is in Suffolk County, but that's something that they would know. Sorry, I can't help you with that one, Joy.
How much OPWDD budget?
So how much do we spend in Suffolk County?
Yeah, I don't know that off the top of my head. I'd have to look into that. And again, it depends on how we look at that, right? Is it for, Medicaid services paid? I mean, we may have an agreement with Suffolk County to do some state paid work. I just don't know what that is off the top of my head.
Okay.
Oh, you're muted, Eli. I think you're
Sorry,
talking.
sorry about that. Sorry. Thank you, Joy.
How much OPWDD budget in Suffolk for 5 year?
Yeah, I don't know. I think maybe we can look at what that is and follow up with Arnold to get you that.
Thank you.
Right. Are there any final questions
I
before
see.
we?
Sorry, Eli. I see
That's okay.
Michelle has her hand up. It's just sort of hiding in the.
I was going to say, I thought I was in the trees. Sorry. I just had a follow-up question regarding the self-direction, because a consistent conversation we have with people here on Long Island who are self-directed is that they're kind of held hostage by the interpretation that the broker and fiduciary intermediary have, depending on what organization or agency they get their services from when it comes to OPS spending. So if this is your broker and FI, you can do A, B, C, and D, but if it's somebody else, you can't do that, but you can do this. So I'm wondering if there is a plan to, I know you have, regulations and there's guidelines for how those things are interpreted, but it's extremely frustrating to the self-advocates on Long Island when several of them have moved from FI to broker to this and that because they're struggling with that inconsistency in how that regulation is interpreted, I guess I would say, if I'm not butchering it.
Yeah, no, I think that's right, and something we've heard not just in Long Island, but generally speaking, the FIs have that job of interpreting and making sure that people are supported to follow the rules, and I think that can lead to inconsistency sometimes. So the regional office has done a lot of work in terms of training fiscal intermediaries, creating guidance for them, bringing them together for regional communities of practice so they can all sort of talk about the same types of services and get on the same page about different community classes and sort of different other items where there's room for interpretation. And so I think that will start to improve. We also are working on a process to release soon that would create another sort of level of potential oversight centrally so that if there's disagreement, it could be brought to OPWDD to sort of facilitate a resolution so that is resolved consistently statewide. Yeah, not the first time I've heard that, and certainly have been working on it and continue to try to roll out a better process so that people can have that consistency and know what to expect.
Great, thanks.
Yeah. Thanks so much for having me today, guys. And Eli, I'm sorry I called you Kevin earlier.
It's okay. Don't worry about it.
Thank you for hosting and for inviting me to come join you guys again. This was great.
Thank you, Commissioner. It was such a pleasure.
All right. Well, we'll see you next time then.
Bye.
All right. Bye, guys.
Bye. Thanks for presenting.
great presentation.
Thanks for all your feedback.
Thank you so much.
All right. I also have another meeting, everybody. So enjoy the rest of the meeting. Thanks so much.
Bye.
Great questions. Thank you. And we will follow. We have been having conversations since they did the self-direction assessment with the commissioner's office, and we will continue to do that and see if maybe we can get some sort of a more public meeting, or maybe bring someone onto this meeting to speak that can answer maybe some more direct questions about some of these things that you guys are asking about. Okay. So thanks, everybody.
Bye.
Bye, Arnold. All right, everybody. It is that time again. We are doing now meditation with Shamika.
Thanks, Eli. Hi, everyone. So this is our time to meditate together. Feel free to turn off your camera or close your eyes, whatever is most comfortable for you. And just relax in your space, wherever you are right now. Just start to take some slow, deep breaths in and out. Not worrying about anything that's on your to-do list, anything you didn't get done, anything that you need to get done. Just be here now, focusing on you, and just breathe in and out. And as you continue to breathe in and out, picture a bright white light in the center of your chest. And each time you breathe in and out, that light grows brighter and brighter and starts to spread from your head to your toes. With every breath in and out. As you breathe in and out, feel your shoulders relax, your neck relax, releasing any tension that you might be holding in these parts of your body. Sending this light from your heart to these parts of your body, and breathe in and out. And let's send some light out to our arms, our hands, fingers, breathing in and breathing out, releasing any tension that you might be holding in these parts of your body. Breathing in once again, see this light move down to your stomach, releasing any tension that you might be holding on to this part of your body. Breathing in, breathing out. See this light move down to your hips and your thighs, releasing any tension that you might be holding in this part of your body. As you breathe in and breathe out, feel your shoulders, your arms, your hips, hips and your thighs. Relax. Seeing this light spread from your head all the way down to your knees. As you breathe in, breathe out. See this light grow brighter, releasing any tension that you might be holding in this part of your body. Take a big deep breath in. See this light go down to your feet, covering your ankles, your toes, releasing any tension that you might be holding in these parts of your body. Let's just take a few minutes and just breathe. Breathing in this light, seeing it spread inside you and all around you, bringing peace to your body, to your mind, and to your environment. Releasing anything that might be challenging you in this moment. Just focus on going within, breathing in, breathing out.
All right. Thank you so much, Shamika. Thank you so much for the meditation.
You're welcome.
Yeah. All right. Next up on our agenda is the Right of the Month, hosted by Marilyn.
Hey guys, we are in March. March is right of the month. It's called Life Plan. You have the right to a life plan that includes your goals, your dreams, your desired outcomes, strengths, preferences, clinical support needs, necessary and appropriate services and supports, identified through an assessment of functional assessment, and health needs, services you elect to self-direct. We've been talking about self-direction a little bit, an appropriate backup plan, and identifies a person who will monitor the plan for self-direction. A life plan, written in plain language, primary, or in a language that is accessible to you. The opportunity to participate in the development and modification of your plan, of your services. Unless constricted, that you can't do it. The opportunity to object to any provision within the plan of services and to deal with the decision of which you disagree regarding your objection. A life plan that allows you to engage in the meaningful and productive activities which take into account your interests and culture. a life plan finalized and agreed to which your written informed consent, which is also signed by the provider responsible for implementing the life plan, your care coordinator, to participate in a review of your life plan, at which you, the parties chosen by you, the service provider, and your care manager, are present. When you review your life plan at your request or the party's request, you have chosen to be involved at least 2 times per year when your capabilities, capacities, or preferences have not changed or have changed. When the plan has been determined to be ineffective upon reassessment of your functional needs. What I'd like to do, and I think the role play team, we're going to start doing this as more of, I think we talked about it, right, Tina? Tina, I think you're still on, right?
She was on Robert's camera, but I don't think I see her.
Oh, she's not on anymore? All right. I do know that we talked about doing a discussion, not more of a role play, but having a discussion. Wasn't that right, Jen? Didn't we talk about that? Jen and Kevin, we talked about that, right? Having a general discussion.
I believe we did.
Yes,
So
we did.
I think what we'll do is for next week, I'll get a hold of Michelle on Monday